UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Nice to have everybody on board. Hey, if you're just checking us out for the first time, or maybe you never liked and subscribed, what are you waiting for? Like and subscribe. We always like that. So today we got a great episode for you. It's about a topic I think that's maybe a little embarrassing for some men, but I thought we'd cover it just to kind of explain about what it is, why it happens, how it's treated. I'm going to talk about buried penis. Yeah, it really is a thing. So let's get right.
So important we do. We're going to break down a condition called buried penis, what it is, why it happens, and most importantly, the treatments that are out there that can absolutely change your life.
Look, if you clicked on this explainer, chances are this is a really personal topic for you or for someone you love. And it's completely normal to feel confused, maybe a little embarrassed, or even just totally alone with this.
But I want to start with the single most important message you'll hear today. You are not alone. This is a real, recognized medical condition, and there is a clear path to getting help and seriously improving your quality of life. So, okay, let's dive in.
First things first, let's get a really solid understanding of what we're actually talking about here. Because the name itself can be a bit confusing, so it's super important that we define it correctly. So a buried penis is a penis that's a completely normal size, but it's hidden or, well, buried by the skin and tissue around it. Here's an analogy I like. Think of it like your finger tucked into the cuff of a really thick, puffy winter coat. Your finger's there, it's a normal finger, but you just can't see it because of all that material around it. And this brings us to a huge point of confusion I want to clear up right now. A buried penis is absolutely not the same thing as a micropenis. A micropenis is something diagnosed when a baby is born, and it means the penis itself is medically small, usually because of hormones. A buried penis, on the other hand, is all about the surrounding tissue. It's a structural thing, and it can happen at any age, from childhood to later in life. So, if it's not about the actual size, then what causes the penis to get hidden in the first place? Let's take a look at the most common reasons this happens.
While there are a few main culprits, by far, the most common is obesity, where a large pad of fatty tissue right above the pubic bone can cover everything up. Another cause is something called lymphedema, which is just a fancy word for severe swelling caused by fluid buildup. Scarring can also be a factor, sometimes from a complicated circumcision or from chronic skin conditions that cause the skin to tighten. And, even the natural loss of skin elasticity as we get older can play a part.
Now, this condition, it is about so much more than just the way things look. It can have a really profound, really challenging impact on a person's everyday life. And this isn't just a feeling. The medical world completely recognizes this. This quote here, it's from a study in the Journal of Urology, and it really just highlights how serious and far-reaching these effects truly are. I mean, these day-to-day struggles are incredibly significant. Urination can become a real problem. You might have spraying or find it impossible to stand. And because moisture gets trapped, it can lead to constant skin irritation and infections. Sexually, it can be painful or even make penetrative sex impossible. And of course, the emotional toll, the anxiety, the depression, the avoiding relationships, it's huge. In fact, that same study found that over 95% of patients reported major problems with both urination and sexual function. That's nearly everyone.
Okay, now for the part I've been most excited to talk about, the path forward. Because the best news here is that there are absolutely effective treatments available.
The great thing is, treatment isn't a one-size-fits-all approach. It's really tailored to you as an individual. It depends on what's causing the issue and, honestly, what your personal goals are. Whether that's just being able to urinate cleanly, restoring your sex life, or simply making hygiene and comfort better. So, generally, we look at two main pathways. The first is conservative care. If obesity is a major factor, a doctor will definitely recommend a weight loss plan. Sometimes medical creams can help with tight or scarred skin, but for a lot of people, especially in more severe cases, those steps just aren't enough by themselves. That's where the definitive treatment comes in, surgical repair. This is where a surgeon directly tackles the physical problem by removing extra tissue, releasing any scarring, and sometimes using skin grafts to properly reconstruct the area.
And let me tell you, the results from surgery can be absolutely incredible. This number right here, 90.3%, that's the patient satisfaction rate from a major study of people who had the surgery. It's just a powerful, powerful number that shows what a real game changer this treatment can be. So what does life look like after a successful treatment? Well, patients can expect a huge improvement in their quality of life. Those goals we talked about, they become reality. Being able to urinate cleanly, having much easier hygiene without those constant infections, getting your sexual function back, and just flowing from all of that, a really significant boost in self-esteem and just overall well-being.
All right, so we've covered what this is, why it happens, and how we can fix it. So what is the single most important action you can take right now?
It's actually pretty simple. Talk to a healthcare provider. A urologist is the kind of specialist who handles this. And listen, starting that conversation is not a sign of weakness. It's an act of empowerment. It's you taking control of your health. It is the first and most important step on the road to fixing this and getting your quality of life back.
Thank you so much for trusting me with this topic today. If you found this helpful and you want more clear, straightforward urology education that's focused on you, the patient, please go ahead and subscribe to my channel.
And finally, just the standard disclaimer. The opinions you heard today are my personal ones and are for informational purposes only. They aren't official medical guidance. So please use your judgment, seek additional advice, and always talk to your own healthcare provider before you take any action based on this information.
So there you have it. If you suffer from this problem, don't suffer in silence. See a urologist. Make sure you get it checked out because there are things that can be done. And one of the things that's really a lot of patients that I've seen in my career, it tends to be obesity. You put on that fat and you grow it everywhere. And a lot of it can be right around the base of the penis where it covers the penis over because it's just got so much fat tissue, and weight loss can help. There's lots of things that can be done besides that. So again, don't suffer in silence. Get it checked out because this is a real disease. And when it happens, it's really tough to deal with because of mentioning things like leaking the urine because you can't get your penis exposed to get a good urination. So you're kind of spraying everywhere, unable to have sex because of that. All things that should be looked into and treated. So be sure to keep joining us. And now next week, I'm going to talk about something called concierge medicine. Is it transforming healthcare? But is it really worth the cost? So join me as I break down what patients need to know about this rapidly growing model of care, from membership fees and insurance coverage to the promise of personalized attention and longer visits. I'm going to cut through the hype and give you the real story. What concierge medicine means, like direct access to your provider, more time during appointments, a tailored patient-first approach, but at what price and what are the trade-offs? So whether you're considering concierge care or just want to stay informed, this episode delivers clear, practical insights. Don't miss it next week on UroPatient. So I hope you enjoyed today's episode. Be sure to always check us out every week. We've got great ideas and great plans for you. So we'll see you all next week on UroPatient.com.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power. We make it clear every Saturday morning. The podcast is here.